Good evening, everyone. Wynn Brown here with Heywood Healthcare's COVID-19 update for Wednesday, April 15th. I hope you all had a good day out there, beautiful day outside. We just went outside and played with the dogs a bit to give them a little exercise before dinner. Hopefully you got outside as well. Let me just give you a sense of what we look like today. First of all, from a testing perspective, we have tested 1,385 inpatients and outpatients with negative findings, meaning no virus detected, for 1,053. Positive findings are up to 232 with indeterminate findings of 9%, or 9, for a positive rate of 18.1. So we have crept up a little bit on our positive. I think earlier today we were 17.2 when I reported to you in the morning. At Heywood Hospital, we have 9 positive patients with COVID-19 and 7 patients under investigation, meaning we're waiting for their test results. I had a couple questions today from folks saying, well, the numbers keep changing for how many positives you have in-house. What's going on there? We have been discharging patients that have recovered under our care and discharged them home, and so that's why the numbers change. Or their testing can go negative while they are with us as well. And we have a couple patients like that at the hospital as well as we're preparing to discharge them. Just to let you know that Mass Department of Public Health now has a website out. It's too long for me to read, but if you go to Mass.gov, it gives the details by town of the test results, positive test results by town. And so that might be interesting to you. Our primary service area, which is 15 communities, says that currently we have 192 positive cases of COVID-19. Doesn't quite mesh with the number I gave you earlier, but remember, people have recovered from COVID-19, and so that's why there's a lower number. I also mentioned last night, I meant to do it this morning, that some people have asked how prepared are we, what is our surge capacity as a health system. And so we have surge capacity on the Heywood campus for 50 beds, which includes doubling up our singles on Watkins 1 and also expanding into our day surgery area. So those are our on-campus capability there to surge. And on the Athol campus, we can surge about 8 to 12 beds above our census that we can take to 21 right now. So that's how many beds at Athol, 21. So we're prepared to do that. Staffing will obviously be a challenge for us. And then obviously our relief valve is the field hospital in Worcester at the DCU Center being operated by UMass Memorial Health System. Just a reminder from Carol Rosa, our Chief Information Officer, we need to be super vigilant about ransomware and phishing coming in through our system. We had a couple of things pop up today, which we luckily seem to have caught, but you need to be super careful about opening anything that is not regular, everyday things that we take care of in the health system on your mail. So, and that goes, I know the community sees this as well. I just got on one of my other accounts, got a reminder as well to really make sure that you're being vigilant about that. And if you do see any suspicious activity on your computer, whether your mouse seems to be moving by itself or something else is going on, you need to report that immediately to the IT help desk at extension 6211, and so that really is a first line of defense is when you notice something going on. Also, for folks who reside in the Winston area and also get their care at Winston Health Center, part of the staffing reductions that we started last week continue today, and we did some layoffs actually at the Winston Health Center, and so I just want to let folks know that that is going on. It's part of our overall planning. Obviously not something we want to do, but the outpatient volume in our practices has dropped dramatically. 50% lower overall, and that's buoyed up actually by the growth in our telemedicine services. So just to let folks know that in case you hear that in the community, that was part of our 295 staff that we changed staffing patterns on last week. Let's see, a bunch of shout outs and thank yous to folks. First to our gown sewers. Thank you to Bonnie Grant, Winnie Rivard, and Susan Sawyer for their assistance in sewing us some isolation gowns. Thank you for that. Also, a shout out to Dr. Joe Yaman of Yaman Orthodontics, and he delivered us a package of gowns this afternoon as well. As I've told you, gowns are the hot commodity across the country to try to have enough of those in inventory. I think Scott Jensen's told me on the shift last night at Watkins 1, we went through 100 disposable gowns on that shift alone. So that just shows you how fast we go through them just on one shift. So it's incredibly important, any support you can provide, and I thank you for that. Also, Tom Kane and his wife Deb. Tom is one of our trustees who represents the Winston area, delivered a very lovely gift card to Sorrento's for staff today, and we'll be using that, so thank you for that. And also Ron and Barb Duval, who are the parents of one of our RNs, Sharon Duval, on the Athol campus. They purchased 20 North Safety 7600 full face respirators and cartridges, and that is amazing. If I told you how much they cost, you would be shocked, and so that is just an amazing gift and stepping out. So thank you very much to the Duval family for that. And then on behalf of Athol Hospital and Michelle Nolette, her mother-in-law, this is at the Athol campus, Luann Bankowski and her sewing friends made and donated more than 200 masks that have been given to the local community and to the hospital and the local community firefighters. So I just love seeing that community work stepping up and stepping out and continuing to do that for us. This is a marathon, and we're gonna have some heartbreak hills in it, and we're really gonna need everybody's support to continue, and it's just, it buoys us up in tremendous ways, and Scott Jensen's will tell you that we would not be in the position we are today if the community had not supported us so widely and continues to support us on our PPE quest to make sure that we have adequate personal protective equipment for our staff and for our patients and visitors. And then when I finish this, which I'm finished with the update now, it's going to transition to a video that our ER department at Heywood put together, and so I'm gonna leave you with that, and thank you for all you do as we continue our journey to be one of the best community-owned health systems in America. We couldn't do it without everyone pulling for us, and I thank you for that and wish you a very good evening. Take care.